Hello, my name's Richard and I'm the Clinical Training Manager for Jenks. Now that we've launched the Stands 2, we're going to take a look at some of the clinical benefits of standing in abduction. So some of the topics that we'll take a look at today, first of all, a bit of a refresher of why it's so important that we get children with disabilities up and standing. We'll take a look at why we might stand some of those children in abduction, what the research and evidence says around that, and we'll also have a discussion on whether or not it's important for older children and teenagers to stand in abduction. So in terms of benefits of adopting a standing position or a standing routine within a 24-hour postural management plan, we know that there's a lot of musculoskeletal benefits and benefits for our internal organs and the function of those systems. And we'll touch upon those in just a second, but at this point I just wanted to also talk about the other side of standing, and that's more of the psychological and social aspect of it. So a child with disabilities that hasn't been in a standing position before, they get a new perspective on life from being in that position. They can gain greater spatial awareness and body awareness, but it also brings them on the same level as their peer group, so they're able to maintain more eye contact and communicate easier, which will also lead to more engagement, so engagement in their meaningful occupations, school activities and play activities, which also means that they're going to be included more and they're going to be able to participate more in activities, which generally leads to a more active lifestyle. So now we're going to just quickly take a look at a systematic review which was completed back in 2013 by a therapist by the name of Ginny Palek. And Ginny, she looked at 687 studies, of which 30 met her inclusion criteria. And really she was looking at dosing, or the amount of time for a child to stand in a standing position to gain a certain benefit. So some of the more general benefits that were found in this systematic review related to things like bone mineral density. So generally they found that quite vastly improved with someone's mineral density within their bones. Also in terms of hip formation, which we'll take a bit more of a look into a little bit later on in this presentation. It also found that there was less risk of dysplasia and subluxation of the hips for children that adopted a standing position. It helped to maintain muscle length, especially in hamstrings, which obviously stays off the onset of contracture formation. They also found that it helped to reduce spasticity and also helped to increase muscle strength and activation. If you're interested to know more specifically around the dosing times, if you just take a look into that systematic review, it's quite easy to find those more granular details. So just to pick out a couple of other benefits found through the systematic review. So it was found that if you stand for 40 minutes, it helps to reduce swelling and breathing difficulties and dizziness, and that was specifically for people with spinal cord injuries. And also 30 minutes of standing also helped children with spastic cerebral palsy help to reduce their spasticity, and they found that this lasted for around 35 minutes after adopting that standing position. So how about standing in abduction? So what does the research say around that? So I've taken a bit of a screenshot from that systematic review, which specifically looked at the studies around abduction. And we're going to focus on two of them today. So the first one, which is the second one down, Marseilles, and that was undertook in Barcelona, I believe, in 2015. And this focused mainly on children with spastic cerebral palsy from the ages of around 12 months up until they were 5 years, so it followed them throughout that 5-year process. And the children were stood in 10 degrees less than their maximum ability of abduction, which was around 30 degrees in each limb. And some of the benefits that they found from doing this over that long period of time was that it reduced hip migration percentage, which also helped to increase their hip stability, and there was no requirement for hip corrective surgery for any of the children that undertook that study. None of the children also displayed a scissoring gait pattern when they were mobilising, and there was a notable reduction of spasticity, and it helped to maintain their adductor and hamstring lengths. The next study that we're going to just quickly take a look at is the third one down, so that's Martinson and Himmelman. And this looked at standing children for around 1 hour a day in abduction, and it showed that it increased and preserved muscle length. It helped to also reduce that hip migration percentage. And the children with cerebral palsy that undertook this study in the control, sorry, not in the control group, in the intervention group, none of those children also needed to have corrective surgery. So by reducing a child's hip migration percentage, effectively we're lowering the risk of subluxation and dislocation, which obviously can result in quite a costly and painful surgical intervention. So to simplify that further, by locating the head of femur at a more exaggerated angle for children with cerebral palsy, it is likely to help them have healthier hips. Now, some of the complications and issues, especially for children with spastic cerebral palsy, we're just going to take a look into some of those now. If we first of all take a look at high tone with the adductor muscles, what can happen there is it can draw the legs past midline, which can also cause a limitation of their range of motion. If this continues to happen for a long period of time, it can also shorten muscle lengths and tendons, which can create a more fixed problem, so that the child isn't able to gain abduction after that. It also can create a more scissored gait pattern, and it makes it more difficult to adopt other positions such as seating and lying. Now also with adductor tone, we need to think about the bony points of the body that are being interfered with there, so knees and ankles, and that can create friction and pressure issues as well. The next complication that we'll take a look at is the malformation of a hip joint. So the research shows from getting a child standing from around 12 months, if they're not doing it by themselves, yields better outcomes in terms of hip formation. So when we're born with quite flat hips, so we don't have that natural hip joint that we kind of see on skeletons and in diagrams. It's actually quite flat, and the head of femur needs to form that groove. And that's done by the process of being in an upright position, load bearing through our hips, knees and ankles, and being really mobile and dynamic is what helps to create those healthy hip joints. So your bones become less malleable by the ages of 6 and 8 as well. So when we're very young, they're nice and soft, and we're able to form those joints, but from the ages of around 6 to 8, they become more fixed, and it's more likely that those issues are going to become more prevalent the older you get. So this is why disabled children that aren't able to stand as much are they're at more risk of subluxation and dislocation of the hips. And this is obviously going to impact a child's ability to function, their ability to be mobile and have that active lifestyle. So now this slide is really depicting kind of hip issues and subluxation and dislocation for malformed joints. So you can see here that the normal joint's got quite a nice groove, which is called the acetabulum, which the head of femur locates into. But as we move across the slide here, we can see that groove is actually not as prevalent, so it's easier for that head of femur to come out of place and become subluxed or dislocated. So the white lines on this slide as well also depict the tendons and ligaments that attach the hip joints together, and you can see that they're being really stretched in that dislocated position. And again, over time, if those tendons and ligaments are stretched to the point past their elastic phase where they've gone into plasticity, so they're no longer able to to naturally regain their original shape, it's far less likely for people with neurodisabilities to regain that elasticity. So again, this can become a more fixed problem. So in terms of what the research shows around this and what we've looked at now, standing in a more exaggerated angle where the hip joint is better located with the femoral head, they're going to be less likely to have these issues. Just to point out some notable research, which we will provide you as well as with a reading list. So if you do want to know a little bit more in regards to the details around this, please take a look at some of these studies, as it will clearly outline what we've discussed and go into a bit more detail around that. Some of the findings from those studies, just in bullet point form. So it's been proven that standing in abduction is a good alternative to a passive stretch, which means that we can maintain the length of those adductor muscles and hamstrings in that position. It aligns the head of femur much better into the hip joint, so they're more likely to form healthier joints and more normalised joints. There's a reduction in spasticity as well, so to give children, especially with spastic cerebral palsy, that relief of their of muscle tone. It helps with that. It can also help to create a less scissoring gait pattern, which we'll talk about a bit further or in a bit more detail a little bit later on. And also there is a reduction in risk in terms of hip migration and dysplasia for children with spastic cerebral palsy. So again, here's just some further findings around improved gait pattern and reduction of spasticity and increasing muscle lengths. So in terms of older children and teens, should we continue to stand in abduction or even start to stand in abduction for older children? As all the research really does point towards early interventions and why it's so important to get started so quickly, as it yields better outcomes. But are there any benefits to standing someone that's a bit older, or to continue that standing program once the child's reached a certain age? So now we're going to take a look at older children and teenagers and whether it's important to either continue to stand in abduction or even start an abduction standing program for someone who's a little bit older. A lot of the research does point or is directed at early interventions and the benefits of hip formation and maintaining muscle length. But are there benefits for older children and teenagers? And should we continue to do so for older children? I personally think it's very easy to argue that absolutely we should, and that's because it doesn't particularly matter how old a child gets. The benefits that we've seen through the research is something that can be generalised into anyone of any age. So issues around someone's gait pattern and spasticity and muscle length only becomes more prevalent the older you get. So the longer we can keep someone in a standing position or a standing in abduction position, if that person is able to maintain that level of abduction and they're gaining those benefits from that, then there's no reason why we should stop that. If we think of a more normalised gait pattern and what that actually means to someone, if someone's able to continue to be mobile, then they're going to have a more active lifestyle, they're going to be able to engage more in activities, participate more, and it's going to be generally a healthier lifestyle for them. Also, in terms of someone's 24-hour postural management plan, by staying off those contractures and the development of other secondary complications, we're able to maintain better seated positions and better lying positions, which again will also contribute to that person's general well-being, but also has been proven to be also life-enhancing. So as we know in previous presentations, that poor postures can lead to very poor health, and in some very extreme cases it can be life-shortening. Maintaining good postures and good positions can only extend someone's life. So just to summarise some of the issues and complications that we're looking to avoid. We've spoken about hip formation and the malformation of someone's hips and why it's important to be standing from an early age. We've also looked at the possibilities of dysplasia and dislocation and subluxation of the hips and why we look to avoid that. Adductor tone and how we can help to keep those muscles nice and long and avoid that scissoring gait pattern, and also the formation of contractures, which in general is one of the most important things that we look to do in a 24-hour postural management plan. We've got the reference list, so if you want to look a little bit further into those details, please do so. We've got that list available for you. We know that getting a child up and standing from a young age yields better results, especially in terms of hip formation. We've also discussed now why it's so important to continue an abduction standing program for a child that's a little bit older, and why we might continue to do that. So thank you very much for listening. I hope you found this useful. Please feel free to contact me with any further questions or anything I can clarify. More than happy to do so. Thank you.